Hello everyone, so today I'm going to talk to you a little bit about gum grafting. Now what gum grafting is, it's a surgical technique to repair gum tissue that's been lost. This little video which I'm going to show you, the first thing you can see in the video is you can see that around the necks of the teeth, which are the brown bits at the top, you can see how the gum has shrunk back. Now where the gum shrinks back, it exposes the root of the tooth, and that means there's going to be a risk of sensitivity. Number one, poor gum health, and importantly the look of it. We call that the aesthetics. So the whole point of gum grafting is to reconstitute the ideal gum architecture that has been lost. Now traditionally there were two approaches that we used. The first one was called a gum grafting procedure, and that procedure was to take gum tissue from your palate. That's called a connective tissue graft, and that tissue is then used to cover over the exposed defect, as we can see in the video, and is then stitched into place. Good procedure, but the drawback of that is you have two areas of minor surgery: the area where the graft is taken from and the area where it's put. So some patients didn't want to do that. Moving forward, the alternative is to use a synthetic gum graft tissue, such as alloderm or a collagen graft. This is synthetic, and that is simply sutured into place. The obvious advantage of that is that you don't have a donor site in your palate, and the uptake of patients for that is a lot more. But again, some people aren't necessarily comfortable with the source of where the graft comes from. Alloderm is donated from human tissue, and that tissue, although it's treated with the DNA taken out of it, people have got to get their heads over the fact it is from donated human tissue. A newer technique is the pinhole gum rejuvenation technique that was invented by Dr. Choi. I believe he's based in California. Now the obvious advantage of this technique, it requires minimal downtime, in that a tiny cut is made to the gum above, and then using special instruments the gum is loosened, as you can see in the video, over the said tooth. That means that the elastic gum is then allowed to be brought up or down. In this particular case, it's brought down to cover over the gum recess and defect. And then what you're then going to use is to use simple collagen tags to hold the gum tissue in place. The benefit of this, it's a relatively easier technique and treatment for the patient. The downside of it is you can't brush the area for 6 weeks, and there are obvious reasons as to why that's important. But ultimately, we have literally three ways of refixing your gums, whether it's a conventional connective tissue graft, whether it's using alloderm, or whether it's using the Choi technique. Each one is case dependent, and depending on the severity of your recession, you'll be advised as to which one is better for you. If there are any questions in relation to that, feel free to send me a DM. My goal is here to help and educate. Okay, take care.